Welcome back, everyone. So glad you're joining us for today's explainer. We're diving straight into a piece of human anatomy that honestly just blows my mind. It's a perfect example of how insanely clever the human body's design really is. We're talking about the internal thoracic artery. Now, if you're not a surgeon, you might not have heard of it, but trust me, this little vessel plays an absolute starring role in one of the most game-changing surgical procedures of our time. Let's get right into it.
I mean, just imagine for a second. What if your heart's ultimate backup plan was literally hiding right there, just behind your ribs? Sounds kind of like the plot of a medical thriller, right? But no, this is just pure incredible anatomy. Today, we're basically uncovering a hidden superhero living right inside your chest. It's an artery that's perfectly positioned and, as we'll see, biologically engineered to step up to the plate when the heart faces its absolute most desperate hour.
All right. Here is our roadmap for today. We're going to cover its origin and pathway, check out its anatomical relations, explore that complex branching network, and wrap up with its role as the ultimate lifesaver.
Okay, part 1. Origin and pathway. Let's trace the route.
So, our journey actually kicks off at the very top of the thorax, right near the base of your neck. You know, every great river has a source, and this artery is absolutely no different. It sprouts right from the lower surface of the subclavian artery, specifically exactly 2.5 centimeters above the inner end of your collarbone. From there, it drops down, and I mean straight down, traveling vertically behind the inner collarbone and those upper 6 costal cartilages. It's actually a super disciplined path. It runs exactly 1 centimeter away from the outer edge of your breastbone. Finally, it hits the 6th intercostal space, and that's where this main trunk wraps up its run. Looking at this, you can really see how this artery visually anchors itself right into the complex web of the chest wall. It's basically acting like a massive vertical highway. Because it runs straight down, it's perfectly positioned to intercept and connect with those horizontal anterior intercostal arteries. It just integrates so seamlessly into the rib cage's whole supply network. It's a gorgeous piece of biological engineering.
Moving on to section 2, anatomical relations, or, the neighbors of our artery.
Now, in anatomy, context is absolutely everything. If you want to understand a vessel, you got to see who's living next door, right? As this artery drops down your chest, the structures sitting right behind it actually change depending on where you look. Up high, above that second costal cartilage, it rests directly against the endothoracic fascia, that's the connective tissue lining the chest cavity, and the pleura, the membrane wrapping the lungs. But once you get below that second cartilage, while the neighborhood gets a little crowded, the sternocostalis muscle actually wedges itself right in there, creating this muscular barrier between our artery and that deeper pleural lining.
And we definitely have to talk about the rest of the neurovascular bundle here. Near the sternal end of the intercostal spaces, the intercostal nerves literally cross right in front of our descending artery. They just boldly step right across its path before piercing the muscles to head toward the skin. Oh, and our artery? It doesn't travel alone. It's got a 2-vein escort, the venae comitantes. These 2 veins flank the artery like bodyguards all the way down to the 3rd costal cartilage. Right there, they join forces, uniting into the internal thoracic vein, which ships blood right back up to the root of the neck.
All right, section 3, the branching network. Let's look at this sprawling system.
So, zooming out from that main trunk, this single vessel is an absolute workhorse. It shoots out 6 major types of branches. We've got the pericardiophrenic artery. Try saying that 3 times fast. That one drops down alongside the phrenic nerve to supply the pericardium and the diaphragm. Then you have these tiny mediastinal branches feeding the thymus. You've got the anterior intercostal arteries supplying those upper 6 spaces. There are the perforating branches, and finally, it finishes with 2 powerful terminal branches, the superior epigastric and the musculophrenic arteries.
Now, I just want to pause for a second on one very specific job handled by those perforating branches, because it's super important. These guys follow the anterior cutaneous nerves straight out through the chest wall. But what's absolutely vital to know here is that in females, the perforating branches coming out of the 2nd, 3rd, and 4th spaces are actually significantly enlarged. They provide a massive, essential blood supply directly to the breast tissue. It's a huge functional adaptation.
And then we get the grand finale. Down in that 6th intercostal space, our main trunk officially wraps things up by splitting into 2. It forks into the musculophrenic artery, which kind of skirts along those lower costal cartilages to feed the diaphragm, and the superior epigastric artery. That one dives straight down into the rectus sheath of the abdomen, supplying the front body wall all the way down to your umbilicus, your belly button.
Which brings us to our 4th and final section, the ultimate lifesaver,
the big clinical climax. Now, if you thought we were just going to do dry textbook anatomy today, well, buckle up. In the clinic, doctors usually call the internal thoracic artery by its older, classic name, the internal mammary artery, or IMA. When a patient develops severe coronary heart disease, which is when the vital arteries feeding the heart muscle get choked up with plaque, cardiac surgeons perform a bypass. They go in, mobilize this IMA, detach its lower end, and physically sew it right onto the coronary artery, just past the blockage. It literally steps in and saves the failing heart.
And this brings us to the big reveal. You might be wondering, why use this specific artery? Why not just grab a vein from the leg like they used to do? We'll check out what our source material says. The walls of these arteries contain only elastic tissue, and the cells of their endothelial lining secrete some chemicals which prevents atherosclerosis. Guys, this is a literal histological plot twist. This artery is practically immune to the exact same disease that destroys the heart's own vessels. That makes it the most durable, long-lasting replacement we could possibly ask for. It's a real game changer.
Now, obviously, you have two of these arteries, one on the left side, one on the right. But in the OR, it's the left internal mammary artery. The lima that gets all the glory is the absolute star of the show. And honestly, it's vastly preferred purely because of geography. It is just so much easier for a surgeon to access it on the left and swing it right over to the front of the heart, compared to trying to pull the one from the right side over.
It is so fascinating to see how medical science has evolved around this one piece of anatomy. Back in the day, surgeons used to just tie off or ligate this artery around the third intercostal space. Their idea was, hey, let's forcibly divert all its blood flow into that pericardiophrenac branch and see if it reinforces blood supply to the heart. As you can guess, that old diversion tactic is completely obsolete now. Today, surgeons don't mess around with diversions. They confidently detach the artery and physically sew the whole shebang directly onto the heart itself.
I want to leave you with this one thought to chew on. How incredible is it that an artery originally just meant to supply blood to your chest wall muscles and your skin has, through the sheer brilliance of modern medicine, evolved into the absolute gold standard for revascularizing the human heart? It's literally a hidden lifesaver. It just waits quietly behind your ribs your entire life, ready for the exact moment it's called upon to keep your heart beating. I really hope you found this explainer as fascinating as I did. Keep learning, keep exploring, and I'll catch you on the next one.